General neurologic exam. Begin the neurologic exam by examining the cranial nerves. To assess the function of the optic nerve, examine the patient's visual fields. First, have the patient cover their right eye while you cover your left. Moving your fingers into each of the 4 quadrants, ask the patient to tell you when they see you wiggle your fingers. Repeat with the other eye. Then, with both eyes open, ask the patient to identify on which side you are moving your fingers, left, right, or both. Test in all 4 quadrants. Next, test the patient's direct and consensual pupillary reactions in both eyes using a pen light. Then check accommodation by having the patient switch focus between your finger held close to their face and a distant point across the room. Look for constriction of the pupils when the patient focuses on your finger. To test cranial nerves 3, 4, and 6, examine the patient's extraocular movements. Instruct him or her to keep their head perfectly still while they follow your fingers with their eyes in a large H shape. Remember to test convergence. Use a cotton tip applicator to test the trigeminal nerve. Break the applicator in half to create a sharp end and a dull end. Show the patient what is sharp and what is dull for reference. Then, with their eyes closed, ask the patient to identify if you are touching them with the sharp end or the dull end. Test in all 3 domains of the trigeminal nerve bilaterally. To test the motor branch of cranial nerve 5, palpate the masseter and temporalis muscles while the patient clenches their jaw. To test cranial nerve 7, ask the patient to smile, frown, raise their eyebrows, puff out their cheeks, shut their eyes tightly while you attempt to pry them open. Look for equal strength and motion on both sides of the face. To test the auditory nerve, ask the patient to close his or her eyes. Place your fingers to the sides of the patient's ears. Rub your fingers together one side at a time and ask the patient to identify which side they hear the sound on. The exam for cranial nerves 9 and 10 starts at the beginning of the exam. You should observe the patient's articulation throughout the history and exam. Also, ask the patient to open his or her mouth and say, "Ah." Look for symmetric movement of the palate. To test the spinal accessory nerve, ask the patient to shrug their shoulders against resistance. Also test neck strength side to side against resistance. To examine the hypoglossal nerve, have the patient stick out their tongue and move it from side to side. Throughout the physical exam, observe the patient's movements and note any abnormalities. To test muscle tone, passively flex and extend the patient's elbows, first slowly and then fast, while feeling the patient's muscle tone. Compare this bilaterally. Next, compare the patient's strength against resistance from side to side. Have the patient abduct their shoulders, testing C5, flex their elbows, C6, extend their elbows, C7, and spread their fingers, C8. Also test opposition of their thumb to their pinky. Later, you will learn how to grade their strength on a scale of 0 to 5. Also have the patient flex their hips. They may do this one side at a time for stability. Flex and extend their knees. Dorsiflex their feet and plantar flex. To assess the integrity of the cerebellum, first perform the finger-to-nose test. Hold your finger about 14 inches from the patient's face. Ask the patient to quickly touch their nose and move to your finger. While the patient continues to do this, move your finger around and see if they can follow. Another helpful test is heel-to-shin testing. Instruct the patient to place one heel just under the opposite knee and slide it down to the ankle. Repeat on the other side. To test rapid alternating movements, ask the patient to extend one hand palm up. Alternate slapping the palm and back of the other hand as shown. Then switch hands and repeat. To perform the Romberg test, ask the patient to stand up and put their feet together. Be ready to catch the patient if they lose their balance. Then ask the patient to close their eyes and see if they can remain steady. Observe the patient's gait as part of their cerebellar function testing. Ask the patient to walk across the room, turn around, and come back. Then have them walk heel to toe across the room, a tandem gait. Ask the patient to return to you walking on their heels. Then have them walk back across their room on their toes. Test the patient's deep tendon reflexes using a reflex hammer. The biceps tendon is located towards the middle of the cubital fossa. You may ask the patient to make a fist to help find the tendon. Then have the patient relax their arm. Place one finger firmly over the tendon. Swing and tap your finger swiftly. You should feel the tendon twitch underneath your finger. The triceps tendon is located on the posterior arm. Support the arm near 90 degrees so the forearm is falling loosely. Smartly tap the tendon and look for the arm to twitch. Always compare reflexes bilaterally. The brachioradialis tendon is located on the radial side of the forearm. Place your finger firmly on the tendon and smartly tap with the hammer, looking and feeling for the reflex. The patellar tendon stretches from the patella to the tibial tuberosity. This is one of the easier reflexes to elicit. To elicit the Achilles tendon reflex, dorsiflex the patient's foot and smartly tap the Achilles tendon with a reflex hammer. The patient should reflexively plantar flex their foot. To test for the Babinski sign, use the tongue depressor or other rigid disposable object. Stroke the depressor firmly along the lateral aspect of the sole from the heel to the ball and follow the ball medially. The toes normally flex downward. If they extend up, an upper motor neuron lesion may be present. Test the patient's vibratory sensation on their index fingers and great toes. Hit the tuning fork on the palm of your hand. Then have the patient close their eyes. Place the base of the tuning fork on the patient's distal interphalangeal joint and ask them when they feel the vibrations. Be sure to intermittently stop the vibrations and test the patient to ensure they are not mistaking the touch of cold metal for the vibratory sensation. Use the same technique on the interphalangeal joints of the great toes bilaterally. Test the patient's sensation to light touch by lightly tapping and brushing the patient's upper and lower extremities with the pads of your fingers. Touch over several dermatomes. Ask the patient if the touch feels the same on both sides or if they feel any odd sensations. If you suspect decreased hearing, use the Weber test. Place the base of a vibrating tuning fork on the center of the patient's head. Ask the patient if they hear the sound equally in both ears. If one sounds louder than the other, hearing loss in one ear may be present. If the patient is hyperreflexive, use the test for clonus. Support the knee in a flexed position. Ask the patient to relax and then sharply dorsiflex the foot. Feel for any continued oscillations between dorsiflexion and plantar flexion, called clonus. This is a sign of central nervous system disease. Normally, the ankle will not respond to this stimulus. Test proprioception bilaterally on the index finger and great toe. Grasp the proximal interphalanx with one hand to hold it still. Grasp the distal interphalanx with your other hand. Be sure to hold the sides of the toe so the patient doesn't feel pressure on the top or bottom of the toe. Have the patient close their eyes. Position the toe either flexed up or down and ask the patient to identify the position. Repeat on the index fingers. To test the patient's ability to distinguish two stimuli, you will need two cotton tip applicators or paper clips. Ask the patient to close their eyes. Alternate touching the pads of their index finger with the end of one applicator and the ends of two applicators positioned no more than a few millimeters apart. Ask the patient to identify if they feel 1 point or 2. To test the patient's sense of graphesthesia, use the cotton tip applicator as a pen. With the patient's eyes open, draw a letter or number on their hand with the end of the applicator. Be sure to draw in the direction a patient would read. Repeat this with the eyes closed using a different letter or number and ask the patient to identify what is written. To test the patient's stereognosis, ask the patient to close their eyes. Place a common object in their hand, such as a key or a coin, and ask them to identify the object by feeling it.